Welcome to our channel. If you need healthcare but don't have insurance, follow these step-by-step instructions to find affordable medical care. Step 1. Visit a federally qualified health center in your area. These community health centers provide comprehensive care on a sliding fee scale based on your income, and no one is turned away. Step 2. Search for free clinics in your community. Many cities have charitable clinics staffed by volunteer doctors and nurses who provide basic medical care at no cost. Step 3. Check if you qualify for Medicaid or subsidized marketplace insurance. Visit healthcare.gov or your state's health exchange to see if you're eligible for free or low-cost coverage. Step 4. Look into hospital financial assistance programs. Nonprofit hospitals are required to offer charity care to qualifying patients and may write off or significantly reduce your bill. Step 5. Ask doctors and healthcare providers about self-pay discounts. Many offer reduced rates of 30 to 50% for patients paying cash rather than going through insurance. Step 6. Use prescription discount programs like GoodRx or SingleCare. These free services can reduce medication costs by 80% or more at participating pharmacies. Step 7. Visit urgent care centers or retail clinics for minor illnesses. These facilities often have transparent pricing and cost less than emergency rooms for non-life-threatening conditions. Step 8. Apply for pharmaceutical assistance programs if you need expensive medications. Most drug manufacturers offer free or discounted medications to patients who meet income requirements. Don't forget to like this video and subscribe to our channel.